Good morning. Today, I will be sharing with you about the 10 steps to successful breastfeeding. Good day, everyone. Today, I will be sharing with you about the 10 steps to successful breastfeeding. The WHO and UNICEF launched the Baby Friendly Hospital Initiative to help motivate facilities providing maternity and newborn services worldwide to implement the 10 steps to successful breastfeeding. The 10 steps summarizes a package of policies and procedures that facilities providing maternity and newborn services should implement to support breastfeeding. WHO has called upon all the facilities providing maternity and newborn services worldwide to implement the 10 steps. This slide shows the infographics on the 10 steps to successful breastfeeding, both in English and in Filipino. So what is the MBHFI, or the Mother Baby Friendly Hospital Initiative? The Baby Friendly Hospital Initiative was developed jointly by the WHO and UNICEF in 1991. This initiative is a global effort for improving health of infants by supporting mothers to breastfeed their babies. It is an initiative that guides the BRGHGMC breastfeeding policy. To assist mothers and infants in achieving successful breastfeeding, all staff receive appropriate education and training on the 10 steps to successful breastfeeding. So all personnel are expected to be familiar with this initiative. So what is the purpose of this lecture orientation? We are doing this because we want to become accredited under the Mother Baby Friendly Health Initiative. We also would like to standardize information sharing and to provide consistent advice and promote practices conducive to successful breastfeeding. We would also like to promote the 10 steps to successful breastfeeding as developed by the BFHI. And lastly, we would like to enable our staff to foster an environment where more women choose to breastfeed their babies, confident in the knowledge that they will be given support and information to enable them to continue breastfeeding. The following slides shows the legal mandates connected or relevant to this advocacy. So, the Mother Baby Friendly Hospital Initiative Program of the Department of Health was launched in 1992 pursuant to RA 7600. This is also known as the Rooming In and Breastfeeding Act of 1992. This is also related to the Executive Order Number 51, dated October 20, 1986, also known as the National Code of Marketing of Breast Milk Substitutes, Breast Milk Supplements, and Related Products. Also, in 2009, the Republic Act 128, or the Expanded Breastfeeding Promotion Act, was signed to support, protect, and encourage women who are breastfeeding working moms. This mandates that all private and public establishments should establish lactation rooms. Again, the WHO and UNICEF issue new guidance to promote breastfeeding in health facilities globally. This new guidance describes practical steps that countries should take to protect and promote, as well as to support breastfeeding in facilities providing maternity and newborn services. They also provide the immediate health system platform to help mothers initiate breastfeeding within the first hour and breastfeed exclusively for the next 6 months. These 10 steps also describes how hospitals should have a written breastfeeding policy wherein staff, competencies, and antenatal and post-birth care, including breastfeeding support for mothers, are encouraged. It also recommends limited use of breast milk substitutes, rooming in, responsive feeding, educating parents on the use of bottles and pacifiers, and support when mothers and babies are discharged from the hospital. So, let us discuss one by one these 10 steps. Step 1. Hospital facilities. We are to comply fully with the International Code of Marketing of Breast Milk Substitutes and relevant World Health Assembly resolutions. We are encouraged as an institution to have a written infant feeding policy that is routinely communicated to staff and parents. And lastly, we are to establish ongoing monitoring and data management systems. In compliance to the Philippine Code of Marketing of Breast Milk Substitutes, the head or director of maternity services can report the following. 1. That no employees of manufacturers or distributors of breast milk substitutes, bottles, teats, and pacifiers have direct contact with the pregnant women. That the hospital does not receive free gifts, non-scientific lectures, materials, or equipments, money, or support for in-service education. And that no pregnant women, mothers, or their families are given marketing materials, samples, gifts by the facility. The written policy in the hospital, which addresses the 10 steps, should be visibly posted in maternity wards, all infant care areas, and antenatal care services. The language or dialect to be used is the dialect commonly used in the area. This slide shows the old policy, the revised 2020 policy, and the poster to be posted in the OB complex, ward, outpatient department, and emergency room. As part of the BRGHGMC staff, we are expected that we will not accept or distribute free or heavily discounted formula, that we will not allow representatives of companies that distribute or market products within the scope of the code open access to staff or birthing women. We are not to receive free gifts, non-scientific lecture, materials or equipment, money or support for in-service education, and or events from these companies. Information to health workers must be scientific and factual. We are not to advertise breast milk substitutes, feeding bottles, teats, or dummies in any part of the hospital. We are not to accept pictures of infants or other pictures idealizing artificial feeding on the labels of the products. The display of manufacturer's logo on items such as calendars and stationery is also prohibited. We are also to keep formula products out of sight from pregnant women and mothers. In our institution, we have a mechanism for evaluating the effectiveness of the policy. The BRGHGMC uses forms for breastfeeding observation aid, client survey, and unang yakap. Step 2. Staff competency. We are to ensure that the staff have sufficient knowledge, competence, and skills to support breastfeeding. All staff involved with the mother and baby should have received orientation on the hospital's breastfeeding policy. Our staff should be trained on 20 hours with 3 hours clinical experience. The new employees are also to receive orientation and training within the first 6 months, and the copy of the course outline used should be available for inspection. Step 3. Antenatal care. Discuss the importance and management of breastfeeding with pregnant women and their families. Breastfeeding counseling to all pregnant women, companions, young mothers, and first-time mothers is done in our outpatient department. The outpatient department antenatal record should reflect the attendance to the breastfeeding lecture and that it protects clients from oral and written instructions for artificial feeding. The antenatal education should include the following: the benefits of breastfeeding, early initiation, the importance of rooming in, the importance of feeding on demand, the importance of exclusive breastfeeding, how to assure enough breast milk, the risk of artificial feeding and the use of bottles, pacifiers, the basic facts on HIV, prevention of mother-to-child transmission of HIV, voluntary testing and counseling for HIV and infant feeding counseling for HIV women, and antenatal education should not include group education on formula preparation. Step 4. Care right after birth. Facilitate the immediate and uninterrupted skin-to-skin contact and support mothers to initiate breastfeeding as soon as possible after birth. Immediate and uninterrupted skin-to-skin contact is done immediately after birth for 90 minutes for those who underwent normal spontaneous delivery and as soon the mother is responsive in cesarean section cases. Our mothers are also helped and encouraged by our staff to recognize if the baby is ready to feed. So, why do we encourage immediate and uninterrupted skin-to-skin contact? It is because it has a lot of benefits for the mother and the baby. So, what are these benefits? 1, it calms the mother and baby. It keeps the baby warm. It assists in the metabolic adaptation and blood glucose stabilization in the baby. It reduces baby's crying and stress. It enables colonization of the baby's gut with mother's normal bacterial flora. It facilitates bonding, and it allows the baby to find the breast and self-attach. Step 5. Support mothers with breastfeeding. We support mothers to initiate and maintain breastfeeding and manage common difficulties. We also offer assistance with breastfeeding within the first 6 hours after delivery. We make sure that the baby is properly latched to the mother. Here are the 4 signs of good attachment. As seen in this slide, first, the baby's mouth is wide open. Second, the baby's chin touches the breast. Third, the baby's lower lip is curled outwards. And lastly, more of the areola is visible above the baby's top lip than below the lower lip. We also show our mothers how to express milk. A breast pump should be available for expressing milk, and milk is expressed at least 8 times in 24 hours. The provision for milk banking in the hospital facility for the collection and storage of breast milk is also encouraged. Where could they get help? Where could our mothers get help if they have concerns or problems about breastfeeding? We are to refer them to OBGYN doctors, lactation management consultants, or our Mother-Baby-Friendly Hospital Initiative Committee. And mothers with previously encountered problems should be given special attention and support. This slide shows the breastfeeding solutions on the common breastfeeding problems. Firstly is when mothers experience latching pain. The solution is to have the baby's mouth cover more of the areola below the nipple than the above. For those experiencing cracked nipples, make sure that the baby has a deep latch and moisten the nipples with ointment or breast milk after nursing. For those with mastitis, they are treated with antibiotics and encouraged to empty their breasts as often as they can. For those with low milk supply, the solution is to nurse and pump as often as possible. For those with clogged or plugged ducts, the solution is to get plenty of rest and to apply warm compresses to your breasts and massage them. For those women suffering engorgement, They are encouraged to hand express before they nurse to get milk flowing, and they are advised to breastfeed more frequently. For those with thrush, they are advised to see their doctor for antifungal medication. And those mothers with inverted nipples, they are advised to use nipple shields or to pump right before nursing the baby. This next slide shows the basic breastfeeding positions we should know. We have the cradle hold, the football hold, the cross cradle hold, and the side lying position. Step 6. Supplementing. Do not provide breastfed newborns any food or fluids other than breast milk unless medically indicated. Mothers and infant diet are observed in the ward for 2 hours. There should be no promotion or display or distribution to mothers and staff of products. If there are bottle-fed babies, mothers should know the indication and the staff should know the indication too. Is it an acceptable medical reason? We also asked the mothers if their babies were fed with food or drink other than breast milk. These are the acceptable medical reasons for supplementation. 1. If the infants who cannot be fed at the breast but breast milk still remains the food of choice. This includes those infants that are weak, those with oral abnormalities, or those separated from their mom. Number 2, infants who may need other nutrition in addition to breast milk. This includes babies who are low birth weight or preterm, those babies who are at risk for hypoglycemia because of a medical problem. Third, infants who should not receive breast milk or any other milk, including the usual breast milk substitutes. This includes those babies with inborn errors of metabolisms like galactosemia or phenylketonuria. Fourth, infants for whom breast milk is not available. These are those babies whose mother died or with no nursing mother available. Lastly, maternal conditions that affect breastfeeding recommendations, like when the mother is very weak, when the mother is taking medications, when the mother has maternal addiction, or those HIV-infected mothers. This slide shows the cup feeding method, which is the recommended method in administering breast milk to admitted babies. This also shows the dental obturator for cleft lip or palate babies. Step 7. Rooming in. We enable mothers and their infants to remain together and to practice rooming in 24 hours a day. We allow mothers and infants to remain together for 24 hours a day, except for a period of 1 hour for hospital procedures, and if separation is medically indicated. Step 8. Responsive feeding. Support mothers to recognize and respond to their infant's cues for feeding. We should know and explain to our mothers the signs of hunger. These are the signs to check that shows the baby is already hungry or the baby needs to feed. 1. If the baby increases eye movements or opens eyes. If the baby opens his mouth, stretches out the tongue. If the baby makes soft whimper sounds. If the baby sucks or chews on hands. If the baby is crying loudly, arches his or her back. We should also note that some babies are very calm and wait or go back to sleep if not noticed. Other babies wake quickly and become very annoyed. Encourage breastfeeding on demand. This means that there are no restrictions on the frequency or length of breastfeeding. Our mothers are advised to breastfeed when the babies are hungry and as often as the baby wants. Awaken and feed. If the baby is sleeping too long, or if the breast becomes overfull, we are supposed to awaken and feed the baby. Step 9. Bottles, teats, and pacifiers. Counsel mothers on the use and risk of feeding bottles, teats, and pacifiers. We are to give no artificial teats or pacifiers to breastfeeding infants. At no point in time should a feeding bottle with artificial teats nor pacifier be used or seen in the ward. Mothers are informed on the risk associated with feeding on artificial milk or other liquids and using teats and bottles. So why is it recommended to avoid using bottles and teats? 1. Because baby may develop preference for it. 2. Pacifiers given instead of feed for hungry baby. And bottles and teats may carry infection. Step 10. Discharge. Coordinate discharge so that parents and their infants have timely access to ongoing support and care. Mothers should confirm their plans to breastfeeding. Our staff should describe how or where to reach the breastfeeding support group in the community and in the hospital. The nursing staff should also be aware that printed materials should be available before discharge. Our mothers are encouraged to follow up after 2 days and in the second week. And lastly, facility has trained breastfeeding mother support counselors. Before we end, let us have a recap on the 10 steps to successful breastfeeding. 1. Hospital policies. 2. Staff competency. 3. Antenatal care. 4. Care right after birth. 5. Support mothers with breastfeeding. 6. Supplementing. 7. Rooming in. 8. Responsive feeding. 9. Bottles, teats, and pacifiers. And 10. Discharge. Thank you for watching our discussion on the 10 steps to successful breastfeeding.